Dr. Leslie Pickens, owner of About Face Aesthetic Centers in Alexandria, Virginia. What we're doing today is demonstrating the Vampire Facelift. The Vampire Facelift incorporates hyaluronic acid filler, 1 cc, that is distributed all over the face, and then followed by platelet-rich plasma that is activated with calcium. We have a young lady here who will be having the procedure done, and we will be administering first the hyaluronic acid. We will not be demonstrating that here because that's a technique that most of us are familiar with. Hyaluronic acid will be applied in the supraorbital region along the orbital rim to give the brow a lift. Also in the inferior orbital area, tear trough. A lot of people complain about the nasolabial folds, but that's because there needs to be volume added to the cheek. So we will be adding some volume to the cheek along with the nasolabial fold and the lateral area of the lip to prevent the downward look of the lips. And then to give some volume and to restore the more youthful looking jawline, we can add a little bit of the hyaluronic acid there. This will all be followed by the platelet-rich plasma, which is activated by calcium chloride in order for the platelets to be activated. So once the hyaluronic acid has been administered, we follow by the platelet-rich plasma in these same areas, which is what I'm going to demonstrate now. So our patient has already been numbed, and what we are going to do now is administer the platelet-rich plasma just a little bit underneath the brow. And we're going to put just a very small amount here. Just to give a small lift. And what we find that we can do to minimize bruising is ask the patient to take her left hand and apply direct pressure. I find that patient participation does wonders to reduce the bruising. Okay, so now in the infraorbital region, we're going to put about maybe about 0.25 or 0.5 cc's. Okay, so we're going to have her close her eyes. Now with the hyaluronic acid, we find that we don't really need to fill the entire tear trough, but just the inferior area of the tear trough. So let's see how this area is doing right here. Okay, so that's good. And I'm going to put just a little bit more in the tear trough area. Okay, and we'll have her hold that. Okay, and in the cheek area, we're going to put a full cc. So I'm going to put about half of the cc very deep. Let me retake this hand and kind of reach over your forehead. So we're going to enhance the cheek, give her a little cheekbone here. So we're going deep, just straight in. If you inject slowly, it will be a little less painful with the tissue displacement. And then I'm going to just angle up a little bit and give her some more volume here. Okay, very good. And she's going to hold that for us. Okay, let's see how this is doing. Okay, and so next we're going to put about 0.5 cc's in the nasolabial fold. Okay, I've got it. She doesn't have very much nasolabial folds to really be concerned with. Okay, we're going to ask her to hold pressure there. So I'm going to come around to the other side. We're going to do her right side. Starting here with just giving a little bit of a brow lift. Good. Okay, and the nasolabial fold, I'm sorry, the inferior orbital area. Okay, and we're going to put a full CC again in her cheek. So right in here. And the good thing about the platelet-rich plasma is it's the consistency of water, really. So it's very forgiving, more so than traditional fillers would be. You just kind of put it in and it just kind of spreads itself around. And as you can see, she's really not bruising because we're applying pressure right afterwards. We're going to have her hold here. I'm going to grab this one. And then we'll do the nasolabial fold on the right side. I had a little left over, like a half. All right, so we're going to put, I think we've got, okay, over here. A half cc in the nasolabial fold. Okay, got it? I got it. Okay, good. Okay, so we'll have her part her lips just a little bit. I'm just going to go direct enter laterally, separating her lip just to give her a little volume. All she'll need is like 0.25 to 0.5 cc's here. Just a little bit here. And then we're going to go just at the wet-dry border here. Give her a little more. Okay, we'll have her hold there, and I'm going to come around to the other side. And do the same thing. I'm just going to add a little bit more here. Try to pull that area out. Okay, now in the pre-gel sulcus here around the chin, just going to give her a little bit of volume. You don't have to go really deep. This is not like your normal hyaluronic acid or Radiesse. Okay, let me press there. And I'm going to grab this. So we can already see that she's getting some nice volume in here. And okay, so really that's pretty much it for the procedure, and you can already start seeing that she's got some volume, and we really have minimal to no bruising. So I hope you got a good idea about the technique for the vampire facelift. Thank you.